Good morning. My name is Adrian Dix. I'm BC's Minister of Health. To my right is the Honourable Ravi Kahlon, the Minister, and I always get this right, of Jobs, Economic Recovery and Innovation. And we'll also be joined on Zoom by Ashna Tapar, a nursing student at the College of New Caledonia, and Aman Gurwal, the President of the BC Nurses Union. And I would be remiss if I didn't take an opportunity to recognize the leadership of Advanced Education and Skills Training Minister Ann Kang, who cannot be here today. But thank you, Minister Kang, for your continued support of healthcare and advanced education in our economic plan. Before I begin, I just wanted to say a couple of things about events in the last couple of days. Some of the behavior, in whether it's in Surrey, whether it's in Oliver, whether it's in communities around in different parts of BC, or whether it's in centre town of Ottawa, when people yell freedom but systematically impede other people's freedoms, whether it be journalists, whether it be citizens in their homes, whether it be students, will always be completely unacceptable. It is not freedom to attack other people's freedoms and rights in the expression of your own desires. And I think the actions that have happened in Ottawa, which are obviously positive for the people in Ottawa, and the actions of the police here in British Columbia have not just been appropriate, they've been necessary, and we are thankful for them. I wanted to say that today's announcement is one of the most important that we will make. The announcement being made by Minister Kahlon today, it's important for, I think, three sets of reasons. One, what's been demonstrated, especially in these 2 years of COVID-19, where BC's economic response, as well as its healthcare response, has been at the highest level. The central importance of public healthcare to the economy has been demonstrated again and again and again to people's lives, to what they do in their work and in their lives overall. Public healthcare is a central advantage of Canada. And we believe it's fundamental to a caring economy. Secondly, in the wake of what's happened, the need in our public healthcare system for new resources, particularly human resources, is critical. Nurses have been fundamental to our public health care response to the pandemic, to the public health emergency that is the overdose crisis, and all of our needs in public health care, in the community, in long-term care and acute care. Nurses have been fundamental. It's important for that reason. And it's also important, I think, because it recognizes the central importance of nurses to our public health care system, and that importance will continue for decades and decades to come. So we're very, very honored to be here today, and it's my pleasure to make the announcement to introduce my colleague, Minister Ravi Kahlon. As you know, Minister Kahlon introduced BC's Economic Plan earlier this week, a plan for today, a vision for tomorrow. And the caring economy, the announcements we're making today are central to that vision. So it's my honor to introduce my colleague, Ravi Kahlon.
Thank you so much. Thank you, Minister Dix, for the welcome, and good morning. Good morning to everyone. I too want to start by acknowledging that we are gathered today on the traditional territory of the Coast Salish people, the Musqueam, Squamish, and Tsleil-Waututh nations. We're here for another significant announcement to help make life better for the people of BC. Thursday, we announced the StrongerBC Economic Plan, a plan that works for you and your families, by tackling the challenges of today while growing the economy that's working for everyone and investing in the most valuable asset we have, which is our people. We've all been through a lot over the last 2 years, from the pandemic to multiple extreme weather events, and we know people are stretched and are feeling exhausted. And nobody more than our healthcare heroes. I want to speak directly to our healthcare professionals. We see you, and the sacrifices that you have made to keep us safe and well throughout these challenging times. From all of us, I want to say a big thank you. To BC healthcare workers, we know that you've worked long hours and shifts, spent time away from your families and loved ones, and of course, you're concerned about your own health and safety as you care for COVID-19 patients and others. From all of us, thank you. We know you need help now and looking into the future, and a strong, well-resourced healthcare sector is a priority for all of us. Over the many months, we've talked to thousands of British Columbians from all walks of life, and you've told us what matters most: access to quality healthcare where and when your family needs it. Because we know that a healthy BC and a healthy economy go hand in hand. When you think about it, what else matters if we don't have our health? And our healthcare system is about skilled professionals to take care of us and our loved ones when we are hurt or in crisis. That's what brings us here today. So on behalf of Premier John Horgan, I'm excited to be here with Minister Dix to announce major steps to move forward our StrongerBC Economic Plan to help further develop our healthcare system. Today, we are announcing that we are adding 602 new nursing seats, 17 post-secondary institutions across British Columbia. At post-secondary institutions like UVic, UBC, UFV, TRU, Northern Lights College, and Selkirk Colleges. With these investments, we will ensure that we continue to close the skills gap, and healthcare professionals have the education opportunities in every region of our province. The new seats will include 362 registered nursing seats, 40 psychiatric nursing seats, 20 nurse practitioner seats, and 100 licensed practical seats. The Ministry of Education has provided $5 million to public post-secondary institutions to prepare to expand these nursing seats throughout BC. I would like to thank Minister Ann Kang, who cannot be here today, for her leadership and continued support of healthcare and in our advanced economy. And thank you to the many collaborative post-secondary education system institutions and partners in this field. This expansion builds on the recent investments we've made in growing programs in education. The Ministry of Health, through the Ministry of Advanced Education Skills Training, has provided approximately $8.7 million to support healthcare education training, including the expansion of specialty nursing programs and launch of a new nursing program in the Northeast. This province is also expanding the laddering seats for licensed practical nurses to move into careers such as registered nursing, to apply the valuable sets of skills to pursue new careers. Increasing the supply of nurses is crucial, but we must also support the next generation of leaders in nursing to mentor and train nursing students of tomorrow. As part of today's announcement, we are also providing $475,000 to investment to support graduate education at UVic, UBC, and UNBC. This funding will aid faculty leadership development in the field. We know that the skills needed, the qualified nurses, has never been greater. Over the next decade, 143,000 job openings are projected in healthcare and social service sectors. With BC leading Canada's economic recovery, today there are 54,000 more people working in healthcare and social assistance sectors than prior to the pandemic. Reflecting our commitment, providing the best healthcare to our people, we know, though, that the work has not stopped. We need to make more investments to make sure that people have the skills, training they need to meet the growing demand. And by doing so, we're ensuring that families continue to be cared for by highly skilled health professionals for many years to come. Because BC's economic plan is here to support families and people, because people are our economy. And the investments announced today will open the doors for more people to join this rewarding, in-demand career. Because with our plan, our government is keeping its focus on where it belongs, on you. With an economy built for you and your family. An economy built for all. An economy that is built to succeed. A stronger BC for everyone. So with that, I want to say thank you and pass it back to Minister Dix.
Thank you very much, Mr. Kahlon. And I want to note that today's announcement, of course, is about building BC's future health workforce while continuing, as we absolutely need to do, in sustaining the extraordinary work done by doctors and nurses, health science professionals, healthcare workers around BC. And the most important part of the effort to build a future workforce are the people who are choosing to go into nursing, making a career choice that will benefit so many people. I cannot think of an activity that has as much more value than nursing. I have to say that it has been our experience over the period of the pandemic, but always our experience, that nurses play such a central role in helping people. What an extraordinary way to spend a life, a career life, to go into nursing. And I am delighted right now, College of New Caledonia, to introduce one of those students going into nursing who's preparing to make that contribution to all of our lives in BC. So I want to go on Zoom to Ashna Tapar. Ashna?
Hi, so first I just want to acknowledge that I am calling from the unceded territory of the Lheidli First Nations. My name is Ashna Tapar, and I'm currently a second-year nursing student at the College of New Caledonia in Prince George. I've wanted to be a nurse ever since I was young. My dad has been a nurse for a number of years, and growing up, he would always tell me stories about his experiences with patients. And it inspired me to go into healthcare where I can care for others and make a positive impact on their health and well-being. In high school, I began volunteering at a long-term care facility where I was able to work with residents, and the smallest actions made such a big difference in their days. And it was a major turning point for me, and it was when I decided that I wanted to go into nursing. Nursing is a career that appeals to me because I want to be able to have a therapeutic relationship with patients where I can positively influence their health. When I think of what it means to be a nurse, I think of a person who provides care, comfort, and compassion to patients. We provide support to patients on some of the most difficult and scariest days of their lives. We've all seen during the pandemic how important nurses are, how hard they work, and how dedicated they are to caring for people. This is the career path that I want. I'm grateful for the opportunity to study nursing and build my future in this incredibly important field. The creation of new nursing seats in BC means even more students like me can pursue this career choice and influence the health of Canadians. Once I finish at the College of New Caledonia, I will be going to the University of British Columbia to finish my program, and I look forward to becoming a full-time registered nurse and continuing to work in British Columbia. Thank you.
Thank you. Thank you, Ashna. And we're pretty thankful that you're going into nursing, and that's an incredible thing. And I know someone who is just as thankful as I am that you're going into nursing, and it's because it's next my honor to introduce Aman Gurwal, who will touch upon what this announcement means for nurses and people in our province. Aman has over 33 years experience in nursing, and she's in 2019 and 2020 vice president of the BC Nurses Union, and she's now the president of the BCNU. I want to acknowledge the BCNU for all it's done, in particular over the last 2 years, in both supporting and defending the interests of nurses across BC, but also their efforts with the Ministry of Health, with the health authorities, and personally with me. I'm grateful for all of their efforts to support us during this extraordinary time when nurses have been under unprecedented pressure in our public health care system, and we've worked together to do everything we can for patients in BC. And the results have been demonstrated, I think, here in terms of our joint efforts, but also the strain that it's put on the system has been significant. So it's my real honor to introduce Aman today. Over to you.
Thank you. Good morning, and thank you, Minister Dix, and congratulations, Ashana, on your career choice. I look forward to speaking with you at some point. So I'd like to begin by respectfully acknowledging that I live and work on the traditional and unceded territories of the Katsi, Stolo, Semiahmoo, Tsawwassen, and Kwantlen peoples. On behalf of the tens of thousands of nurses in this province, I am pleased to be here with Ministers Dix and Kahlon today on their announcement of the 602 new nursing education seats. For nurses, this investment is a promising step towards addressing the staffing crisis that is currently crippling our healthcare system. Nurses' staffing levels were already critical before the pandemic, responsible for creating cracks in the system that have only deepened. Now, Our nurses are tired, they are burnt out, and they need more support. For years, we have been standing up for our healthcare system, advocating for enough resources spent in the right ways to sustain the healthcare needs of British Columbians now and into the future. And there is no doubt that we need to be thinking about the future of nursing in BC. Last May, during the third and fourth waves of the pandemic, nurses told us how they were faring. Among the highlights, 76% of nurses surveyed said their workload had increased compared to before the pandemic. 51% of nurses working in our ICUs and ERs said the experience of the pandemic had made them more than likely to leave nursing in the next 2 years. What we need is more nurses. It fills me with tremendous hope to know that the demand for nursing programs around BC is there. Whether it be UBC, Selkirk College, Thompson Rivers University, or another one of the many institutions offering nurse education programs, there are hundreds, if not thousands, of people who are ready to jump into this wonderful and meaningful profession. This is why it is critical that we do everything we can to make it possible for them to achieve their goal of becoming a nurse. Right now, there are thousands of nurse vacancies across this province. We must focus on retaining the nurses we have today and aggressively recruiting nurses for tomorrow. Again, the announcement of 602 additional new nurse education seats is a promising step towards solving the staffing crisis. As we wait for the government to outline its 2022 fiscal priorities later this week, the BC Nurses Union is more focused than ever on ensuring the nursing profession remains a top priority of this government. On behalf of BC's nurses, we look forward to working together with all parties involved to build on today's announcement for the future. Thank you.
Thank you, Aman, and thank you for all your work and all the work of nurses across British Columbia, particularly over the last 2 years, but really every day, regardless of the circumstances in healthcare in our province. We know that expanding our nursing workforce is not the silver bullet for solving all nurse labor shortages and healthcare capacity. Increasing our supply of world-class nurses represents a key component in a broad-based strategy to support our healthcare workforce. Since taking government in 2017, the growth of practicing registered nurses and licensed practical nurses has grown faster than the population in BC. It's also, for registered nurses, led the country in growth. However, we are also asking nurses to do more and more important things in our healthcare system, and we need to continue to make these investments, both supporting and sustaining nurses, and Aman spoke about retention, which is a critical question for us, the recruitment of more nurses, addressing issues around internationally educated nurses, and so on. But I'm very, very proud of this announcement today of 602 more nurse spaces, which builds on our Budget 2021 announcements and will be an important component of the Provincial Health Human Resources Strategy outlined in my mandate letter, which will be announced in the coming months and which will be critical to continuing building our healthcare system comprehensively. COVID-19 and the ongoing toxic drug crisis have shown us the importance of investing in world-class nursing programs. It's shown the fundamental importance of public health care to our lives, every aspect of our lives. And these investments today will ensure our healthcare workers have the support they need to meet tomorrow's healthcare needs. We are committed to expanding high-quality public and universal healthcare. We will continue to make the right investments in our system and the people at its heart. We're going to do it for nurses, we're going to do it for healthcare workers, health sciences professionals, doctors, other health workers, because, and most importantly, for patients and the people of BC who depend on our universal public health care system now more than ever. It's the right thing to do to have more nursing seats. It's the right thing to do to support public health care. Thank you, and we're happy to take your questions.
As a reminder to media on the phone, please press *1 to enter the queue. That's *1 to ask a question. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Shannon Patterson, CTV. Please go ahead.
Oh, hi, Minister Dix. A couple of questions for you, unrelated to today's announcement. What can K-12 parents expect this week with respect to rapid test distribution at schools? How many schools will actually send the tests home this week? And what about seniors? When could that start, and where might that distribution happen?
As you know, we announced that 6 million rapid tests are going to schools, either K-12 or post-secondary education. Approximately 3.5 million of them, or half of them, have been sent, so they're on the way. So that process will start for students this week. I think what we're looking to do, as you can see by the numbers, is sending home packs of a pack of 5 for each student and family that wants them. And so that's a significant process, roughly 600,000, more than that, in our K-12 education system, and then as well into post-secondary education. We have not received this week's, as of today, we're expecting it today, the 2.9 million allocation from the federal government, which is coming, but we expect it in the next couple of days. Following the distribution of the 6 million rapid tests to education, we're following that up, working with community pharmacy to distribute first to seniors across BC access to rapid tests. I expect that will start either at the end of this week or the beginning of the following week. And as those arrive, and we're now expecting, and you'll remember back to the announcements and the details I made last Tuesday about 9.9 million supplementary tests. We expect them to come in sort of tranches of 2.5 million over the 4 weeks following that, and they'll be distributed out accordingly. So we're going to be doing it first for those who are older, over 70, and then we're going to go down the age group to give access to rapid tests. So what you're going to have is a very significant distribution of rapid tests to students and their families, who represent a very large share of British Columbians, and then to seniors, and then we're going to go down through age groups as the rapid tests arrive. So far, I think we had, as of last Tuesday, we distributed about 7.5 million. Another 2.5 to 3 million have already gone out, and the remainder will be going out this week. And so part of that will depend on the distribution at the school level, but we're expecting that the former to happen this week, and the latter to seniors to happen either the end of this week or next week. And I'll have significant details about that at our briefing with Dr. Henry on Wednesday.
Shannon, did you have a follow-up?
Yeah, this is a question for a colleague. The decision to reinstate hospital parking fees is generating some pushback with an online petition asking for workers to be exempt. That petition has reached 35,000 signatures. The ministry says it's working with health authorities to address this. The fees are being reintroduced in a couple of weeks. Can you say whether hospital workers will end up having to pay when that happens?
So with respect to parking fees, here's what's happened since over the last 20 years. We saw massive increases up to 2017. Since 2017, fees have been frozen in BC. They've been frozen everywhere in BC. And in April of 2020, as a measure during the pandemic, we decided to eliminate those fees on a temporary basis, which we've done now for almost 2 years, and they will be reinstated with some significant changes. Families of children who are staying overnight will continue to have their parking free. Many chronic patients who go regularly to the hospital will continue to have it free, and the fees will be reinstated at 2017 levels. So we've frozen the fees. We got rid of them for 2 years as a pandemic measure, and we're returning them with changes to make life better for especially the families of children who need to be in hospital, and for people who are chronically need to be in hospital because they require regular treatments there. And I think that's a significant and positive change. It shows, I think, how our efforts to make life more affordable. It has been necessary to reinstate the fees, as you know, and this has been reported repeatedly, really, through the pandemic, and we have many cases of this, of people using hospital parking, especially in urban areas, as free parking for other purposes. So we need to manage the system appropriately, and we are. but the fees will be reinstated, but they'll be reinstated, continue to be frozen at 2017 levels when I became Minister of Health, and of course they'll be continue to be free for a very significant portion of the people who need them.
Our next question is from Amy Smart, CP. Please go ahead.
Hi there. This is a question for the president of the Nurses Union. I'm just wondering if you can help put this 600 seat number in context. You mentioned the staffing crisis. Do you have any figures in terms of the number of nurses that have left the profession during the pandemic, or kind of the shortage? Any kind of numbers that would show how much this is making up the gap that we need to fill?
I'll just give you some of the numbers, and absolutely, Aman will throw to you. The number of registered nurses increased by 6% since 2017-18. The number of LPNs has increased by 12%. And so those are net increases. But I think what Aman will tell you is the workload has also increased. And what we're asking nurses to do, their role in the system continues to rise. We've doubled the number of nurse practitioner space, for example, and very significantly increased the number of nurse practitioners. And in spite of that, there are very significant challenges in the system. But when you're looking at a base in the public institutions of 2,000 seats, an increase of 600 really is exceptional. The investment in the training as well, the training capacity is important. As we all know, it's important. These are very significant and serious training programs, and they require us to also increase the capacity of our training in the system. So those are the core numbers. Number of nurses increases in BC faster than anywhere else, but the demands on nurses increasing, I think it's fair to say, even more. And so the need to invest in the future, and as well, we have the pressures in the system do lead to pressures on people leaving the system, and the fact that our aging population in BC means that in many healthcare categories we have an increasing number of people retiring in the system, and you need to replace those. So over to you, Aman, to say a few more things.
Thank you, Mr. Dix. So yes, the nursing shortage has been increasing through retirement, as well as our nurses are burning out, their workload has increased significantly, and the acuity of the patients has increased significantly. So this is a first step in investing in our staffing crisis, but we will be working with Minister Dix and Minister Kahlon to make sure that we're going to be receiving more seats into the future, because that is one of the items that will help to address the staffing crisis. Another one will be the retention. And then, as Minister Dix also mentioned, the internationally educated nurses who are here right now in BC, and how we can make that transition for them to be integrated into the working force.
Amy, did you have a follow-up?
Yes, I did. This is a question for Minister Dix. The Canadian Association of Physician Assistants says 15% of members want to work in BC. They say they're qualified to cover about 70% of doctor or family doctor duties. Your ministry has said adding these positions aren't part of your plan, given the enormous difficulty of many people face finding a family doctor. Why is that?
Well, first of all, physicians' assistants are important in some parts of the country where they're trained. We don't train physician assistants right now in British Columbia. What our focus has been doubling the nurse practitioner seats, and that's been our focus over the last number of years. And you can see its impact, particularly in primary care and in team-based primary care. We have team-based clinics in BC that have doctors and nurse practitioners and nurses and pharmacists and dietitians and other healthcare workers. And that is the approach, that team-based approach to care. I don't exclude the idea of including physician assistants in that, but our priority has been, and just very clear about this, to increase the number of nurse practitioners. The latter, the physician's assistants question, would obviously require the development of programs in BC and here in order to make it work. And it's something that we look at, but we've shown what our priorities are, which is the really remarkable investments we're making today in nurses, in nurse practitioners, in health and health science professionals, the more than 6,000 healthcare workers that have been hired to support long-term care. Those have been our priorities so far. We don't exclude the idea of physician's assistants, but our priority has been, as you can tell, to significantly focus in the area of team-based care and primary care on nurse practitioners.
Our next question is from Simon Little, Global. Please go ahead.
Hi, this question is for both Ministers Kahlon and Dix. RCMP had to be deployed yesterday after anti-mandate protesters targeted Mike Farnworth's home. We're just looking for your reaction to protesters escalating to coming to the private home of one of your colleagues.
Well, I'd say this. I mean, what we saw yesterday, we saw it in Ottawa. We saw it in going to people's homes. We saw it at 176th and 8th in Surrey with respect to journalists. And we've seen it this past week in Oliver. And I have to say, again, that we do have a right in this country to dissent and to criticize. This is a democracy, and we're very proud of that. But we don't have the right, I think, in the exercise of that, to attack other people's freedoms. This is not an issue, whether it's a journalist, whether it's an elected person such as Mike Farnworth, Mr. Farnworth, whether it's healthcare workers in Victoria, whether it's the people of Centretown in Ottawa. We don't have the right to abuse other people and other people's freedoms in the interest of our own freedoms. There are no freedoms without responsibilities. There are no freedoms without responsibilities. And part of our responsibility to one another, it seems to me, part of our responsibility to one another is not in exercising and enchanting freedom to abuse other people's freedoms. That doesn't work. It doesn't work. It can never work. In this country, in this province, 93.6% of people in British Columbia, of adults, are vaccinated. 93.6%. Yes, there are divisions, but those divisions on the issue of vaccination are 16 to 1 on one side and the other. That doesn't mean the one can't speak its mind or that person's mind, but it doesn't mean they can say that we're going to continue to interfere with other people's freedoms until you change the policy. Policies have been open and generous and effective in BC. We continue to do that. And all of those nurses we've talked about today who work in our public healthcare system have provided some of the most outstanding care to people who are unvaccinated, because we provide care for everyone, and everyone has the right to make mistakes. And they have received from our nurses and our doctors and our health sciences professionals and our healthcare workers consistently the best possible care in the world in a public healthcare system that's there for everybody, no matter what your views. That's the kind of province we have in British Columbia. I'm very proud of that, and I think that the kind of activities that have gone on that have for their goal to impede other people's freedoms, I think, like you and like the vast majority of British Columbians, I find it completely unacceptable.
I'll just add that, everyone has the right to protest, but like most British Columbians that turned to their televisions to see the images of reporters being spat on, certainly my colleague having people outside their homes, I found quite disturbing. And what I found the most offensive was they wrapped themselves with a Canadian flag to justify to help justify their behavior, and that's what I found the most offensive. That's not who we are as Canadians. I think most Canadians watched these images and thought that that's not who we are, and so it's obviously disturbing to see what's happening. But seeing them wrapping their flags and saying this is about being Canadian is certainly not what I believe. Certainly not what my colleagues believe. Can we do it at the end?
You want to do it at the end?
I'll do it at the end, yeah.
Okay.
Simon, did you have a follow-up?
Yeah, just on today's announcement, what is being done to ensure that the graduates of these programs actually stay in BC? I know it's a hot competition for nurses all over North America. What's to keep these new nurses working here?
Well, I think we're building, first of all, and you see this in Minister Kahlon's economic plan, we're building outstanding healthcare facilities everywhere. It's been 20 years of wait to start to build a new St. Paul's. And we're building a new St. Paul's. It's been a decade of wait to build a new Mills Memorial Hospital in Terrace, and we're doing that. And in all the other communities, from Fort St. John to Dawson Creek to Prince George to Quesnel to Penticton to Kamloops, and all over Metro Vancouver and to Cowichan on Vancouver Island, building the best quality healthcare facilities in the world to recruit people into acute care. It's advancing the position of nurses in primary care, and everywhere, registered nurses, LPNs, nurse practitioners are playing an increasingly important leadership role in primary care and in community care. It's playing a central role in addressing the mental health and addiction crisis and expanding the scope of practice of nurses because of the extraordinary quality of nurses in our province. Is to ensure that workplaces are respectful and support nurses against violence, and it's to ensure that we have the best healthcare system in the world, a place people want to come. Nurses do come here to work from all over the world and from all over Canada, and I believe they'll continue to do so. And they'll continue to do so if we continue to invest in a public health care system that supports them.
We have time for one more question. Our final question today is for Leanne Young, CBC. Please go ahead.
Hi there, Minister Dix and Mr. Kahlon. Thanks for taking my question. So, as you addressed earlier, talking about the protests outside your colleague Mike Farnworth's house, are you concerned that these protests will escalate, putting possibly your personal safety at risk, your other colleagues, as you stand by the vaccine mandate?
Well, first of all, the decisions that we make with respect to the requirements of vaccination for healthcare workers, and you'll know that in terms of requirements for vaccination, by public health order, those requirements are for healthcare workers, both those in the system. It already applies to 129,000 healthcare workers in the core system, to 50,000 or so, 48,000 workers in long-term care, and that will continue. And those requirements will continue. In British Columbia, we take a balanced approach. So last Wednesday, Dr. Henry and Premier Horgan announced the relaxing of some measures, of some restrictions with respect to the COVID-19 pandemic, but we've left others in place, including the BC vaccine card, which has more than 4 million people in BC with that card, which is used very effectively and which has saved lives and allowed us to open activities that would not otherwise have been opened going back to last August and September. Those continue to be in place for the moment because we need a balanced approach. There are and there were, as of Friday, more than 700 people in hospital dealing with COVID-19 in our province, about 114 in critical care. And so we continue to need to have that balanced approach guided by public health, guided by the science, and we're going to continue to do that. And the reason that we were able to relax some measures last week wasn't because of people shouting abuse. It was because of the actions of British Columbians who followed the public health guidance, who followed the order. 93.5% of adults have been vaccinated against COVID-19, and that we've all contributed together. This isn't anyone's success. This is our success together. And we're going to continue to do that and not be thrown off by all of these things. And yes, what's happened in the targeting at times of individuals, including our provincial health officer, Dr. Henry, and we should all be honored and proud to have her at the heart of this effort during this pandemic. She has done an exceptional job, and yet she from time to time, is the subject of unacceptable abuse. That includes Minister Farnworth, who's an outstanding leader in protecting people. And we're going to, I want everyone to understand this, we're going to be speaking to and speaking for all of those British Columbians who really, including the nurses we've spoken to and the nurses that work in Amangura-Walls Union, the BC Nurses Union and the HEU and the HSA and the doctors of BC. We're going to be speaking for all of them and supporting those efforts. So our efforts will be unmoved by abuse because we have in BC people across our province and every community who have stepped up at every stage to support one another. We've been kind, we've been calm, and we've been generous to one another. And that's the reason we're successful. And we are not changing that approach now.
Leanne, did you have a follow-up?
I did. Sorry, there's my baby screaming in the background. Thank you for that very thorough answer. So my last question is, what's your government doing then to reach out to these groups who are digging in their heels? And they seem to be increasingly inflamed. You know, we've heard about a lot about misinformation. What's your government doing to address that?
Well, a number of things that have happened from the beginning, which is providing information about the pandemic, making vaccinations available for free everywhere in every community across BC, large communities and small communities, making it available to people so that they can be protected, making the most recent information regularly available to people about the effectiveness of those vaccines, some of the most effective vaccines we have ever seen in the history of vaccines are the ones we have now that have dealt with COVID-19. To continue to have them available, there's a new vaccine available now, the Novavax vaccine, which will be of interest to, I think, some British Columbians who have not yet been vaccinated, and we're hopeful about all of that. And so, it's continuing to be generous to everybody. You know, we've been through, particularly the period of the Delta variant, but now, the period where overwhelmingly overrepresented in our healthcare system are people who have not been vaccinated. You're 30 times more likely to be in ICU if you haven't been vaccinated. 30 times. It is a staggering number. And I want everybody to know that everyone in our public healthcare system, regardless of their circumstances, regardless of their views, regardless of the mistakes they made, will be welcomed by our exceptional doctors and nurses and health sciences professionals and healthcare workers. We should be proud of that. This is who we are as people, and we're going to continue to speak, reach out with generosity to everyone. There has been no effort, and it's been part of, I think, the unique part of our pandemic here, to treat and speak to everyone with generosity. And we're going to continue to do that regardless of what other people do. Thank you.
That's all the questions we have today.
That's all the questions we have today.
Thank you, everyone, for joining.
Merci beaucoup. À la prochaine.
Thanks, Bella.